Steve Davis started out as a physician, but his career development brought him to his current role as Chief Operating Officer of Cincinnati Children's. He feels that feedback, when properly done, is important to both the employee, the manager, and the whole organization, and it needs to be a part of managing a team every day.
Feedback once a year is useless.
Here he is to explain.
So Steve, what is performance development and why do we use it at Children's?
So performance development is essentially the process of making sure that employees have the knowledge, skills, and attitude they need to be successful at work. The reason that it's important, well, there are many reasons. Probably the most important one is that that's what our employees are telling us they want. Employees don't want to come to work and just do the same thing every day. They want to feel like they're getting better and they're contributing. We're really fortunate here that we have a mission that our employees really get around. And so they really want to contribute to helping make kids' lives better. And the way they do that is getting better at their jobs.
When you say that employees really want this, and we know this from the employee engagement survey, what do you think it means to give an employee really good feedback on their performance?
There are many different views of feedback. The way I look at it is important to let employees know both when they meet the needs or when there's a gap in their performance. Everybody comes to work wanting to do a good job. On occasion, sometimes people don't, and it's our job as managers and leaders to help them get there.
When you have a conversation with managers who might be struggling with approaching performance development in the right way in this organization, what do you tell them? How should they think about it?
Managers often get promoted into those positions because they excel at their own job, but they often haven't had to give other people feedback, and it can be difficult to do. So it takes some time, and the thing that I tell everybody is just practice and be sincere. If you let the employee know that you really care about them, they hear whatever feedback you give them much better than if they don't know who you are or don't think you care about them.
It's providing feedback within the context of recognizing what their contributions are, what their interests are, and where they want to go in the organization and where you see their performance can take them.
Exactly. So I'll give you a little story from early in my career when I was the fellowship director and I had no experience giving feedback. And I had a group of fellows who had varying talents, one of whom I thought was absolutely exceptional and had the chance to be the best critical care fellow that I'd ever worked with. I didn't think he was giving full effort, and I didn't know how to get that effort out of him. So I kept giving him feedback that he wasn't working hard enough. He wasn't pushing, and he got very frustrated with me, and I started noticing it. And then I decided one morning to take him for a cup of coffee and just say, you know what? I really want to help you, but it doesn't seem to be working. What's going on? And he actually said to me, you're much harder on me than you are on everybody else, and I don't think it's fair. And I took a step back and thought about it for a second and realized I was harder on him than the other fellows. And then I explained to him, you are the most talented fellow I have ever worked with. You can be spectacular, and I see it as my job to help you get there. And all of a sudden he had this look on his face of, you don't hate me, you don't think I'm doing a bad job, you just know that. And so we ended up having a long conversation, and he's been my closest friend for 25 years now. Had we not had that conversation, what the disconnect was, we might never have developed a friendship. He might never have gone on to being just a phenomenal critical care doctor.
How important do you think it is to take an employee kind of outside of the norm of the everyday? You mentioned having a cup of coffee with this person. How does that play into that conversation?
Yeah, hearing feedback is not easy. It makes people uncomfortable. And so one of the things you can do is to try to put people at ease and put them in a situation where that they know you care about them and you're really trying to help. So the first thing is never give constructive criticism in public. in real time when an employee maybe doesn't do the right thing or has an issue or doesn't know what to do, your best bet is to pull them aside. If you do it in front of their colleagues, they immediately shut down. And there's actually good research to show that people can't learn in that environment. Things that are going on in their brain actually prevent them from understanding what you're trying to get at. And it's often why people keep repeating the same mistakes. And new managers say, well, I told them 3 times. Well, if you embarrass the person while you're telling them, that ability to understand is limited. So I find that for certain conversations, it's nice to just take somebody out of that environment, have them relax a little bit, know that you're there to help them, and then they can often hear you better. But they're not going to hear you if they're intimidated, afraid, or nervous, or embarrassed.
I'm glad that you brought up research, because one of the things that we've seen is that people get frustrated when they don't get feedback except for once a year. And there is a lot of research to say that that continuous feedback or that, rhythmic feedback is more effective. What would you say to managers who say, I don't even know how to do this. I just do it once a year. I fill out the forms that I need to fill out. How can they make it more part of their routine?
So feedback once a year is useless. It has to be frequent, in small doses, and as close as possible to the performance that you're trying to have an impact on. So when somebody is struggling with a certain task, while they're struggling with it, if you can help. Now the approach I try to take is when I see someone doing something well, I try to stop them and say, tell me about that. What are you doing? How did you know, if you're dealing with an angry patient and you're able to settle them down, right afterwards I'll ask the nurse, how did you know to approach the person like that? And let them talk about it. And that reinforces the behaviors that they did that got a great outcome. And so I try to give more feedback that accentuates great work, because I think it's important to try to help people do more of that. But when they're struggling, the time to do it is in real time, hopefully in private, and letting them know you care about them. If you give somebody feedback even a week later about a situation that didn't go as well, they're not going to remember all the details, and they're not going to internalize it the way you want them to. So as close to the time as possible is key, and as frequent as possible. It also lets them know you care about them, because you're not just doing it once a year because you have a form to fill out.
You talked about the manager perspective and the approach that managers should take. What about from an employee perspective? If I'm an employee, how should I be thinking about getting feedback or asking for feedback from my manager?
I think what works well is when the manager and the employee actually have a discussion around how the employee likes to get feedback and what the manager's style is. And so that they can figure out what works best for both of them. As an employee, most people want to know that they're doing a good job, and they also want to know if they're not. As I said, everybody comes to work wanting to do a good job. We're fortunate here that our employees come wanting to do a great job, and they believe in the mission so much that they want to do a great job, and they're willing to hear when they're not, as long as you give it to them in the right way. So I've always taken the approach of asking them, how do you like to get feedback? What is the best approach that works with you? And then try to individualize it. There are some people who just want, they're just the facts, please, just the facts. And then there are others who really want to take the time and understand why you think that way. Sometimes it may seem like a debate, and I think it's okay to engage in that, as long as they understand that there are certain things in the organization that you just sort of have to do. But I think the best approach is to individualize it for the two people.
I want to ask you about a story about when performance development is done really well and what it looks like from a zoomed out perspective. Why should this be something that we care about as an organization and we want to do well?
There are many reasons why performance development is key. As I mentioned earlier, that's what people want. From the organization's perspective, we are at a time when there may well be significant nursing shortages in the future. There may be some physician shortages, there are many positions where we're not sure there'll be enough people to do them. So to be competitive as an organization, we have to be a place that people want to come work and then more importantly stay. And one of the ways to get people to come work here and to stay is to invest in their development. People love to get better at their job, and there are many examples of people who start out in one part of the organization and then grow and develop into a completely different area. My own career path is one that I would not have predicted. I started out as a pediatric critical care doc doing basic science research at Johns Hopkins, and then over the course of time, people saw abilities in me in operations, and they started giving me opportunities that I never thought about in medical school or even in residency or fellowship. And as I progressed, I started doing more and more, and now I'm the chief operating officer. Had you asked me 10 years ago, do you think someday you'll be a chief operating officer? I would have said, absolutely not. Why would I even want to do that?
As Children's continues to grow, what is most important for employees and managers to know about performance development and where it's headed and where it's headed within our organization?
We've been improving and updating our performance development processes and our system. I'd have to say a few years ago it was a pretty tedious process, and it was mostly about filling out the forms on time. And that's not really what it's meant to be. And I think the HR team and the organization and managers have done a much better job in letting people know what good performance development looks like. Things like meaningful conversations classes and many of the leadership series that have gone on in the organization really put an emphasis on what it means to be a great employee and what it means to be a great manager. If you have great managers, the great employees take care of themselves because people come here wanting to make a difference. And so it's our job as managers and leaders to make sure we get the best out of all of our talented employees.
One of the interesting things about healthcare and hospitals in general is the variance in which there are different roles that have different levels of exposure to patient care and patients and families, but they all play a role in creating this culture. So how do you recommend people address performance development when maybe they work in a different function outside of the clinical care sector or outside of operations?
One of the things I love to do here is walk around and talk to our employees. And the reason I love to do that is so many of them can connect what they do to the patients. I'll give you a great example. There's a valet, a young guy who was a University of Cincinnati student working as a valet part-time. I happened to be observing the valet process to see if I could improve the efficiency of it. And I watched this young man for a while, and he was running back and forth. But every time he got to a car, he would slow down, gather himself, he'd smile, he'd greet them, very friendly, and then he would ask them, where are you going? How can I help you? And then he would take them, rather than just saying, go down to the corner, turn right, and then take your second left. He would take them there. So I decided to ask him, why do you put so much effort in your job? And he said, I'm the first person that greets a Cincinnati Children's patient when they get here. And they're coming from a distance. Most of them are afraid. They don't know where they're going, and if I can get them off on the right start, that makes their day a little better. And I'll tell you, the next thing I said to him was, when you finish school, call me because I want to hire you for another job at Children's. That attitude that he had, that he was the person who was going to get them off on the right start, was perfect. Last week I shadowed people in the cafeteria, and one of the things that I really enjoyed was the World Cuisine Station. And I was talking to the chef behind the counter, and I said, tell me about this. And he said, well, we have patients from all over the country and from all over the world. And food is what makes people happy. And if they can go up to the World Cuisine counter and recognize some food from their culture, whether it be Italian or Mexican or Thai, it makes them feel good. And so we rotate the food here so that there's something for everybody. And he was so engaged in making sure that he could have a little comfort for people in times of stress. And that's one of the reasons I love working here. Our employees get it. They know that they could work in other places. So the cleaning people can work cleaning a factory, they can work cleaning an office, but if you talk to them, they know when they go in the room, they have a chance to talk to families and make their day a little better. And so it's not just cleaning a room, and that's why it's great to be here.
Is there anything about performance development that you think it's really important for people to know that you might not have had the opportunity to say yet?
That it is an expectation for managers that you do it and do it well. And so my advice is really practice it and actually work with a manager who's a peer of yours and practice giving feedback. See how that goes. Get a little more comfortable at it, because if you're nervous, you're going to make the employee nervous. And once you're both nervous, you think it's going to be worse than it is. And so just working at it, get comfortable, and practice it. Also know there are tools that you can use, guides and job aids that will help. They're available on Centerlink, and they really do give you sort of a checklist of here are the things that you ought to do that work, and here are some things that you should avoid because they don't work as well as we'd hoped.
Thank you very much for your time today. We really appreciate you sharing your insights with the Cincinnati Children's employee and manager population on the topic of performance development.
Well, thank you for having me. It was really worthwhile for me, and as you can tell, I love this place and our employees.
Try to keep feedback close to the performance. Address a behavior, positive or negative, as close to the time as it occurred. Never present constructive feedback in public. And when in doubt, always go for coffee. I've tried our world cuisine, but I don't know the name of that valet. But I've met a lot of people like him. They're right here at Cincinnati Children's, and they're changing outcomes every day. Take care, and thank you for listening and learning about performance development at Cincinnati Children's.